This Act enables private companies to hide behind the NHS logo. This Act means private companies will be able to pick off the easiest procedures. This Act will, through corporate lawyers, favour big business.
It has been argued that it is quite deliberate, and it's deliberate in order to open up our public health services to commissioning. It is something of enormous complexity which I suspect only corporate lawyers are going to be able to understand. It's something like 10 times the length of the original Act that brought the health service into being in 1948.
There were an extraordinary number of briefings that came out explaining that this was the abolition of the NHS, that the duty on the Secretary of State to provide and secure healthcare was going, and that the democratic basis and legal basis for the NHS was being destroyed.
One of the government's major tools is really public ignorance and professional apathy to drive through these ridiculous reforms, which will actually benefit no one but the commercial interests and perhaps politicians who will go on to serve on boards of these companies.
British Rail was run down for some years systematically before the privatisation. And in fact, that is a standard privatisation strategy. It makes it easier. The expert on this is Oliver Letwin MP, and he has written a nice book called Privatising the World in 1988. And in that, he sets out a number of important tactics for governments who are trying to privatise public services against the wishes of their population. And among them, there are a couple of key steps. One is to restrict the budget so that the public service gets worse and worse and worse, and then privatisation can be represented as a step up, which of course in practice generally it is not. But if you make the public service bad enough, people will perceive it that way. So it's a deliberate policy.
The full extent of the repercussions of the 2012 Health and Social Care Act are only just starting to be felt, and I think it's only in years to come that we will see the full impact of that, but certainly I know from my colleagues and fellow clinicians that they do feel that the impact is already being felt.